is Julie Agnew, and I'd like to welcome you to our program, the ARC Alliance Building Bridges in the Community. In this program, we discuss issues that affect persons with disabilities such as autism, spina bifida, cerebral palsy, Down syndrome, and intellectual and developmental disabilities. The ARC Alliance was founded in 1951 by parents of children with developmental disabilities, and since that time, we have remained a family-driven organization. The ARC Alliance firmly believes that persons with developmental disabilities should be able to experience a life similar to that of individuals without disabilities. We believe in full inclusion and would like to see all persons with disabilities live, work, and play in the communities where they live. Today, our topic will be legislative issues in Pennsylvania, and our speaker is going to be Katie Yost from the ARC of Pennsylvania. Welcome, Katie.
Hi, Julie. Thank you for having me.
It's very nice to see you. We have some questions for you. What are the key budget priorities of the ARC of Pennsylvania?
Thank you for the question, Julie. So we are in budget season right now. The Pennsylvania state budget, according to law, has to be passed by June 30th of this year. So we run July 1 to June 30th. That's our fiscal year. So the ARC of PA is currently advocating to legislators on the Hill in Harrisburg about three key issues. Number one is a wage issue, and that is for early intervention birth to 3 therapists. The rate of reimbursement that providers are able to pay to therapists have not been increased more than once in the past 15 years. And unfortunately, that has put us in a position where now that we have a generation of therapists who are about ready to retire, we are not able to recruit or retain new therapists who are coming out of school because they have a lot of student debt. And because Pennsylvania is the sole payer for the rates that providers can give early intervention therapists, we cannot bill Medicaid, we cannot bill medical insurance or hospitals. So we're unable to compete with large hospitals or nursing homes or medical centers that can offer large sign-on bonuses. So that's one of our top priorities. And then following along with the wage issue, our other big priority is the direct support professional crisis, or it's actually almost beyond a crisis now. We are seeing a collapse of the system. And direct support professionals really are the backbone of the intellectual and developmental disability community. These are the individuals that enable individuals with IDD to live in their communities. They provide supports and care from them, everything from daily hygiene to transportation, job coaching. These are really the people that are in the trenches, the individuals and their families. And again, because Pennsylvania is the sole payer of this system, and they kind of set the rate of reimbursement that we can pay direct support professionals, we are seeing a real crisis of where providers cannot recruit and retain staff. And that's really important because without staff, individuals might not be able to go out and be independent in their communities and might not be in the safest environment. Across Pennsylvania, the median salary for a DSP is $13.20, which is nowhere near a livable wage. And in areas where you have warehouses offering a $15 an hour starting rate, or even Sheetz and Wawa that are starting employees at $15 an hour, our group just cannot compete with that. And we really believe that the work a DSP does is truly a calling. It's very personal, and it is also something that they take great pride in. And if we don't have that workforce, we cannot support people in the community the way that they need to be. And our last big issue is the waiting list. So in Pennsylvania, we have a waiting list of eligible individuals with intellectual and developmental disabilities and autism who are waiting for waiver services in Pennsylvania. And waiver services are how individuals are able to get that support that they need in the community through Pennsylvania. Across Pennsylvania, we have over 12,000 individuals waiting for services, and of those, 5,000 are on an emergency waiting list. This means that they need critical services immediately or within the next few months. And the people on the emergency waiting list are some of the most vulnerable. And I routinely see that emergency waiting list individuals are they have elderly family caregivers. It is not uncommon for us to see parents who are in their 80s and 90s caring for their adult child with disabilities as they've done their entire life. And an individual will go on the emergency waiting list whenever their elderly caregiver unfortunately passed away or is in a hospital or is put into a nursing home. And then there's no one able to care for that individual. We also see single caregivers of any age, also a reason that individuals are on the emergency list. And it really is critical that Pennsylvania addresses these issues. The governor has proposed to remove 832 individuals off the emergency waiting list. This would help us put a starting dent into that. And he would use $13.9 million state funds, which are also then matched almost dollar for dollar by federal funds. So again, our key priorities for the budget this year are early intervention rates for birth to 3, direct support professional wages, and also the waiting list.
Who are you talking to when you want to address these issues?
So we specifically first go to the members of the legislature who are on the appropriations committees. So there's a committee in both the House and Senate, and these committees are made up of legislators. They are picked to be on different committees, but the appropriations committee is really where the communication and negotiation happens on what is included in the Pennsylvania state budget. It's still important if you have a constituent or not a constituent, I'm sorry, if you are an individual and your legislator is not on the appropriations, but it's still important for all legislators to hear budget issues because in the end of the day, they will all vote on it. So the Pennsylvania budget to become law has to be voted by at least 2/3 of the both House and Senate, and then it gets sent to the governor to be signed. So our first step is to always meet with appropriations committees, and then we also send out wider blast to all legislators.
Okay. Our next question is, how is the Arc of Pennsylvania continuing to fight against segregated institutional care? And what exactly is segregated institutional care?
So segregated institutional care is a state institution. So this is a really archaic system. It is old. This is a system that was set up at the end of during the 1800s and early 1900s, when individuals with intellectual and developmental disabilities were born. Doctors would encourage parents to send their child away to these institutions to live because it was thought to be better for the child and the parent wouldn't be able to care for them. Most of these institutions are out in the middle of the countryside. They are not near other individuals. And the only people who reside there are people with intellectual developmental disabilities. They are not around their non-disabled peers other than the caregivers that they would have in the facilities. So currently in Pennsylvania, we still have 4 institutions left. So we have made great strides over the last 60 years or so to close state institutional centers. But really, we're striving as the Arc of Pennsylvania. Our key value always is that an individual with intellectual or developmental disabilities is supported in their community. They are with their peers. They have opportunities to go to places of worship, to be employed, all of those options. Currently, we have 2 state centers that are slated to close mid next year, so about August of 2022. And by closing those 2 state centers, individuals residing there get the option to pick where they want to go. And a really big issue that we heard about when this was first announced, and also something that's completely false, is that individuals who are living in those institutions will just be out on the street. That's not true. The individual, their caregiver, their guardian will work all together to find what placement works best for them. So if that's in a community, they go to the community. If that's in another state institution, they will go there. If it's a private institution or what is called an ICF, they will go there. So again, the ARC-PA is always striving to see all individuals with disabilities living in their community. And currently there are only about 630 2 or 39 individuals who reside in the 4 state centers. So again, we are making great strides, and the ARC is routinely supporting the Office of Developmental Programs who are running those closings. And we're also trying to fight this by just providing knowledge to policymakers and legislators and the general public about institutional care and also the history of it and why that's no longer an option for Pennsylvania. We're ready to move forward and to have people.
Okay. How about another system, the criminal justice system? In what ways do you think the criminal justice system can be reformed to support individuals with intellectual and developmental disabilities?
So I think criminal justice reform is a very hot topic right now, and it's from all minority group sides, which people with disabilities are a minority group here in the United States. Some ways that we can do that are with hate crimes protections for people with intellectual and developmental disabilities. So currently in Pennsylvania, there is not a hate crimes statute that says if a person specifically targets an individual with an intellectual or developmental disability to harm them due to the sole fact that they have a disability, that is labeled as a hate crime. So that is something that we're seeing. We've seen some action happen last legislative session to try and address this. It didn't make it through the legislative process. And we've seen some bills introduced this legislative session also that would put that in statute. Another way that we're seeing reforms happen is actually just a recent announcement yesterday from Senator Bob Casey on the federal front. Senator Casey plans on introducing bipartisan legislation that really seeks to address how police officers and members of law enforcement interact with people with intellectual and developmental disabilities and autism. There's a lot of misunderstandings, and there's also a lack of knowledge on understanding how behaviors manifest under certain disabilities. And really, Senator Casey's legislation, which has not been introduced yet but should be coming soon, will really seek to address that on a federal level. Because I think one of the ways that we really see, not just with law enforcement, but also the general public, is more awareness happens, more understanding happens. So then an officer who's responding to a distress call for an individual with autism is going to recognize that if the individual has autism, yelling or screaming or shining a light in their face isn't going to make them comply due to their sensory issues. So really, we're hoping to see a general growth in knowledge on that. And lastly, to highlight, I know that across the state right now, there are some regional summits that are being held between the autism community and also members of the court system. It's including judges, defense attorneys, and prosecutors to really understand how individuals with autism who are going through the criminal justice system will act, and also really try and address the disproportionately high number of individuals with disabilities who are incarcerated, and in general incarceration, where maybe they should be referred more to a mental health area or something of that nature. So we're seeing some positive steps. Hopefully those continue to grow.
Okay. Let's switch gears a little bit and talk about education. So why is it essential for Pennsylvania to increase special education funding?
Yeah, so we at the ARC of PA are very passionate about special education and inclusive education that comes within special education. So in Pennsylvania, special education is one of the top priorities in the fact that special education is one of the highest costs that school districts have. And that's due to the mandatory costs that come down under the federal guidelines under the Individuals with Disabilities Education Act, what's known as IDEA. And IDEA is so essential for students with disabilities. This is the law that says students with disabilities are supposed to be educated with their non-disabled peers. They are supposed to receive a free and appropriate education. And also special education, especially in the final years, is very key for individuals with disabilities as they transition into adulthood. So because education services are so important, it is really the Commonwealth of Pennsylvania's duty to fund special education. We had not this past year, but the year before, so the 2019-2020 school year, we did see a $50 million increase for special education funding that the legislature and then the governor signed. And that was fantastic. That was very much needed, but that didn't bring us up to date for the previous years of no increases at all. So the ARC of Pennsylvania is joining other education advocates to call on the General Assembly to approve the governor's proposal for $200 million increase in special education funding. This is truly essential, especially in the wake of COVID-19. Students with intellectual and developmental disabilities were disproportionately impacted by COVID-19 and the move to virtual learning. While we certainly recognize all students had learning difficulties with the virtual format, for students with intellectual and developmental disabilities, most of their supports and services did not translate well into a digital sphere or within their own IEPs, and how they learn as an individual were not supported well. So in order for us to ensure that all students with disabilities are able to get caught up in their education and really address that educational regression we saw during COVID, this increase to special education will really go towards that. It will support school districts as they need to hire more special education teachers and also really begin that foundational support that special education gives to individuals with disabilities.
Okay. Are there reforms that you think need to be done in the education system in support of education?
Yeah, there's two big reforms that the ARC of Pennsylvania is working on, and one especially right now. The first is an initiative that would allow students with intellectual and developmental disabilities who are turning 21 and set to graduate at the end of this school year, so the 2020-2021 school district, be allowed to have an additional year of school during the 2021-2022 school district. And the ARC of Pennsylvania has heard from parents, we've heard from students themselves, other educational advocates, that there is truly a need for this additional year. As I said earlier, the final years are so key to students having those transitional supports for their turning into adulthood. A lot of these transitional supports is what gives them the skills for independence. It will help them make connections in the job world and then also become competitively employed once they are an adult. So it really is critical because a lot of parents, as their students are set to graduate, are truly scared because their child is leaving an inclusive environment. Nowadays, in this millennial generation, students with intellectual and developmental disabilities and their non-disabled peers have gone through classes together. They have had socialization, but there's this really fear that their child is about to fall off the cliff as they enter adulthood, and they don't know what's going to happen. So by giving the option for students with disabilities who are set to graduate to have that additional year will really help adjust them as they enter the adulthood world. So then our second issue that we are advocating for is that the special education funding formula that is used for how school districts are paid or used for how much they get for every student with intellectual and developmental disabilities they serve needs to be applied to how charter schools receive their funding for special education students. Currently, that is not how the system is set up. The school districts use the formula, and then the charter schools are based off of a median percentage of whatever that school district has. And part of the special education funding formula really is centered around a tiered system where an individual with intellectual developmental disabilities, the lesser supports and services they need, the less funds that a school district will need. So if you're in a tier one, you'll need less services. So that means the school district will need less funds to make sure you have all of the supports and services under your IEP. Where if you're a tier three, you are most likely highly complex and you are going to need a lot of supports and services. So the school district will receive more funding. And we really believe that's an approach that the PA General Assembly put in within the last decade or so, and it was really critical for addressing equity. And that's the whole issue with why we believe the formula should be applied to charter schools is an equity issue. Charter schools should have that same application of the formula, and then that'll really help school districts save money because currently if a charter school has a median percentage, they'll get that median cost per student. So even if they're serving someone who is a tier 1 student who might need less supports and services, they're getting funding as if they were a tier 2 to tier 3, depending on what their district makeup is. So again, the whole reason we support that is equity.
So it would be better use of the funds. They would
Exactly.
actually be needed. Okay.
Yep.
Okay. How can increasing the levels of employment for individuals with intellectual and developmental disabilities impact individuals in the entire community?
Yeah. So employment is a really big and hot topic right now, especially as we're coming out of this COVID-19 pandemic. And unfortunately, Pennsylvania has some work to do with getting individuals with intellectual and developmental disabilities competitive integrated employment. Pennsylvania is an employment first state, and that means that we have said that we are dedicated to ensuring that individuals with intellectual and developmental disabilities will have the prioritization to be employed, and that Pennsylvania will work to ensure that they can get meaningful, competitive, integrated employment in their communities. That happened back in 2018, and we are trying to keep increasing our percentage. The Employment First Commission released their latest report in October of 2020, and that said that currently 16.6% of individuals with intellectual and developmental disabilities between the ages of 18 and 64 are employed. It seems like a low number, and it is. We are currently trying to increase that. We understand that the COVID-19 pandemic has certainly put us back a little bit. And unfortunately, we were seeing a trend that individuals with disabilities were the last that were being brought back into their employment. So we're really trying to emphasize to employers that individuals with disabilities can still do their jobs. And a lot of that was due to their medical complexities or medical health within regards to safety in the pandemic. So I think it's still key that we continue to build that knowledge base in Pennsylvania, especially with businesses and industries, about how individuals with intellectual and developmental disabilities are really an untapped workforce. We have the workforce. We have individuals who want to work, who want to go to work and earn a paycheck and have that fulfillment as an individual in their community. And we're just seeing continued growth of stigma barriers preventing individuals from being hired in competitive integrated employment. They have the skills, they have the opportunity. You just might need to be a little creative for how it's implemented. But we really believe that as more and more businesses begin to have inclusive hiring practices and really promote hiring individuals with intellectual and developmental disabilities, we'll continue to see a growth in that, and that other companies will see the benefits in hiring a diverse workforce.
Okay. Back to the education system. What is burden of proof? And what would it mean for Pennsylvania to put the burden of proof on the school district instead of on the parents?
Yeah, so burden of proof is in regards to whenever there's a disagreement between parents and a school with the implementation of the parent's child's individual education plan or IEP. And if the school district is truly giving the child that free and appropriate education that is required under the IDEA. So if a parent is challenging a school district's implementation and their how they're doing their child's education, under Pennsylvania law, it is actually the parent's responsibility to prove that the school district is not doing what they're supposed to be doing. At the ARC of Pennsylvania, we really believe that duty to prove should be with the school district, and the school district should be the one who is proving that they are meeting the requirements of the IDEA and the child's IEP. And this is for a few reasons. One, because the school district has access to those files, they have access to professionals that a parent won't have easy access to. The school district would have that ability to show that. And number two is due to a financial issue. Most parents, if they do have the ability and want to strive to challenge the school district and go into or be a compensatory or due process hearing, that costs money for lawyers. And for a lot of parents, the cost for due process hearing is just too high, especially for parents of low income areas and parents of minorities who might not have enough money to hire an attorney to do that. So by really Pennsylvania addressing this issue, they are really saying that they prioritize a student's education and also the family, in understanding that the school district should have the duty to prove that they are providing the education as they are supposed to, rather than requiring the parent to prove that the school district is not. So it's just down to an issue of making sure that all students with intellectual and developmental disabilities have a full and inclusive education.
Is due process hearing the only way that a parent can get a change to a plan if they feel like it's not meeting their students' needs?
I can't speak to that fully just because I'm not a lawyer and I don't know all of the ins and outs on that. But there's also compensatory education that can be gone through. And sometimes changes to a student's IEP, if the parent doesn't agree, they and the school district can work well and they can make those updates and changes. It's only in those cases where we have parents who truly believe that the school is failing their child. And that's really when the burden of proof would come in, not for typical general updates to a child's IEP.
Thank you, Katie, for joining us today. That was a lot of really great information. And thank you all for joining us. I hope that you found the presentation helpful. If anyone would like to be involved to help the ARC Alliance achieve its mission of full inclusion, or if we can be of any assistance to you, or if you have any additional questions, please feel free to contact our CEO, Paul Stengel, at 484-868-0443.